My name is Mallen, and I'm a writer and educator. And for the last 9 years, I was the director of a small nonprofit for writers. One of my essays, published a year ago by Huffington Post, outlined the difficulties of being moderately immunocompromised, living with autoimmune hemolytic anemia as the COVID public health emergency ended. The Facebook groups Waha Warriors and Catty Chatter shared that essay, and I'm grateful for the many emails, conversations, and connections those posts elicited. I'm honored to do this presentation and to bring awareness to autoimmune hemolytic anemia. The tricky part in doing something like this, however, is balance. And so I'll also consider the question, how do we share living with autoimmune hemolytic anemia without overly identifying with illness? I live with lupus and both warm autoimmune hemolytic anemia and cold agglutinin disease, referred to as mixed AIHA. My immune system has two ways to target my red blood cells for destruction, and my symptoms get worse when my hemoglobin is lower: shortness of breath, fatigue, heart arrhythmias, weakness, and headaches. Before I go any further, I want to mention another disease. Back in the 1980s, as a teenager, I was diagnosed with endometriosis. At the time, almost no one had heard of the term. In fact, I went through 2 years of testing and medical confusion before one doctor suggested my mother take me to the Leahy Clinic outside of Boston. Doctors there performed diagnostic laparoscopic surgery and discovered endometrial lesions in my pelvic cavity, and I finally received treatment. In the decades since, there have been loads of articles about endometriosis. Celebrities have shared their stories about living with it, and foundations have funded research on this insidious and often painful condition. Today, I would bet most people have heard of endometriosis. This fact is directly associated with efforts to raise awareness. Talking about it, sharing what it's like to live with it, there are benefits to this. Not only does it give others a chance to understand and have compassion for those who are suffering, but it can also bring more research dollars to improve clinical outcomes. So it is a good thing that autoimmune hemolytic anemia has its own awareness day. It provides an opportunity for others to learn, understand, and find compassion. And it could help encourage more research as well. Most doctors who are not hematologists have never seen cases such as ours. They might have read about it or learned about it in medical school, as my cardiologist and so many of my doctors told me, but they've never seen a patient with autoimmune hemolytic anemia. So raising awareness in the medical field, especially beyond hematologists, would benefit us a great deal. I've lived life as a patient since I was a teenager. Endometriosis dominated those early years. I had a hysterectomy and went through surgical menopause at age 36. 3 years later, I was diagnosed with lupus, and my rheumatologist insisted I file for Social Security disability, and I was approved on my first application. With a master's degree in teaching, I shifted to tutoring part-time, and I tried to live my life without too much emphasis on being sick. For these last 11 years, I've attempted to find a balance while living with autoimmune hemolytic anemia. Before COVID, I probably did a decent job of it, although it might be more accurate to say I actively worked on this, that I wasn't just someone with a disease or two. I have rewarding relationships with family and friends. I am a gardener of vegetables, herbs, blackberries, butterfly-friendly plants, tropical fruit, and orchids. I dabble in watercolors. I took piano lessons for 11 years as a kid, and I'm recently playing again. I'm passionate about teaching, a career I enjoyed for almost 2 decades. I ran a literary nonprofit and I wrote grants. I also write and publish short stories and essays. So I can find that inner calm, even though I live with fatigue, frequent blood draws, bouts of moderate to severe pain, and the occasional bone marrow biopsy. There were times when it was impossible to ignore my status as a patient. A 3-day hospitalization and months of recuperation from cardiomyopathy, along with a breast cancer diagnosis in 2018, stole my peace temporarily, yet I found my way back to living well with just chronic, mostly mild anemia. Unfortunately, though, once COVID hit, this changed. Any infection can be problematic for somebody with lupus or autoimmune hemolytic anemia, but COVID can trigger cold agglutinins and warm AIHA. So on the advice of multiple doctors who told me I remain at high risk for complications from COVID, I mask and avoid crowds. I visit with family and friends outdoors. And I know this looks like pathological anxiety to many people, but my doctors and therapists assure me that it's normal when something invisible has a high chance of making me very sick, and when my health relies on the behaviors and beliefs of other people. So is it possible to share the details of my medical condition without constantly focusing on it, without overly identifying it with it? I wrote about this a year ago, and the Huffington Post published that essay, and all I can say is that COVID makes it more difficult. Ignoring the risks would be foolish and dangerous, but still living with precautions is hard. I was diagnosed with autoimmune hemolytic anemia in 2013 when my rheumatologist, who had been closely following me for lupus, noticed that I had developed anemia. "This is new," he wrote on the lab report and circled my hemoglobin. He handed me that report and told me to bring it to the hematologist appointment that his secretary was setting up for me. That hematologist ran a battery of tests and did in-house blood work, a complete blood count, CBC at every visit. The third time I was there, the phlebotomist returned to the examination room to draw more blood as she said something went wrong. She returned a third time with the doctor, who explained that my blood had clotted and made a mess of their analyzer machine. They had to open it up and clean it out from top to bottom. The doctor had the phlebotomist draw more blood, put the vials in a cup of warm water, and walk them to the lab immediately. He called me a few days later to confirm that I had cold agglutinin disease caused by an IgM clonal antibody. He said he'd only seen one other case in his entire career. He explained that it was rare, but I would probably simply have to stay warm. Further testing revealed that I also had the warm IgG antibody version of autoimmune hemolytic anemia too, which puts me in a very rare category. The website OrphanNet, a rare disease database, reports the incidence of mixed autoimmune hemolytic anemia as less than 1 in a million. Both types of antibodies mistakenly target my red blood cells for destruction, which creates symptomatic anemia and fatigue. Both can cause organ damage and can be fatal if hemoglobin drops to severe levels and is untreated. I was first treated for lupus with prednisone and hydroxychloroquine, which is Plaquenil. Then for many years, just Plaquenil with occasional prednisone to calm the hemolysis. I discontinued hydroxychloroquine when I had cardiomyopathy, as it can cause the condition. My doctors have discussed other drug treatments at time when my hemoglobin dropped lower than 10, but it's complicated for me as a mixed patient. The first-line treatments for warm and cold are different. My hematologist said she'd like to figure out which one is driving my hemolysis, but it isn't easy. During the pandemic, her plan was to start with IVIG, intravenous immunoglobulin, as that would be safer than other options like rituximab and prednisone, or a combination of the two. Rituximab is a type of immunotherapy. It targets a protein found on B cells, and so it could reduce the clonal population. Yet rituximab alone doesn't work for everybody, and patients are severely immunocompromised. If it does work, it's most often temporary. Last year, severe abdominal pain triggered an ultrasound and additional blood work to check my iron levels, which were way too high. I was sent to a hepatologist and ended up with a specialized MRI. He documented a mild iron overload in my liver due to chronic hemolysis for over a decade. Damaged red blood cells release iron into the bloodstream, and plus my body mistakenly holds on to more iron than I need from my diet, likely due to me constantly making new red blood cells. There's no easy way to treat this. Typically, someone with high iron has a genetic condition called hemochromatosis. I don't have that. In that case, the doctors can order regular blood draws or donations to reduce the overall iron. But in my situation as an anemic patient, having blood removed on a regular basis is just not an option. So the iron deposits in my liver will be monitored, and iron chelation drugs, which have significant side effects, may be required. Also last year, I suffered a hemorrhage in my left retina, which my specialist said was due to the anemia. Years ago, when I went for a second opinion, the doctor told me I would likely have to go on drug treatment at some point in the future to, what he said, buy some time. So I'm glad there are more options today than there were when I was first diagnosed. And JMO is a new drug that works differently than rituximab to stop hemolysis and seems to be better tolerated. This might be an option for me. As a cold agglutinin patient, I'd like to raise awareness about how frustrating it is to get blood work. Our red blood cells clump or agglutinate at room temperature. This happens in our bodies also, in fingers, toes, nose, ears, any place that can get chilled. As the rogue antibody targets the red blood cells for destruction, they link together, and The only way to get correct readings is for the phlebotomist to keep the blood warm and rush it to an in-house lab, either in the hospital or the hematology office. Even at the hematologist's office, with a note in my file, I often have to explain and coach the technician in drawing my blood. The vial should be warmed with a baby heel warmer. Then the blood needs to be drawn into a warm tube, which stays wrapped up in the warmer and delivered to the lab. It's impossible for the typical commercial lab like Quest or LabCorp to get a CBC, as they send the vials out to be analyzed and often refrigerated. Over the years, many phlebotomists and nurses either ignored my explanation or placated me that they knew what they were doing. Once, rather than a baby heel warmer, what looked like a hot pack was used, and of course I was called back to redraw those tests. Pretty sure they cooked that blood. Another time, a nurse in the emergency room nodded and acted like she was listening, told me she'd run the blood right away, but ignored my pleas to get a warmer. I know from experience that my blood will clot in the tube by the time she takes a few steps down the hall. So she finally admitted they had no warmers in the ER, so I suggested and sort of begged her to put the vial in a cup of warm water. It's difficult to teach medical professionals, but it's often necessary to avoid getting repeatedly stuck. The Cold Agglutinin Foundation provides patients with small cards with information to be handed to phlebotomists and sent with the blood vials to the lab. Yet, while these cards have been very helpful, more than once the medical personnel glanced at the card with suspicion, handed it back to me, and ignored it. If I could bring awareness to only one thing, it would be this: there's an accepted best practice for handling blood with a cold agglutinin. It often helps me to remember that everyone has unique challenges. Humans have all sorts of medical, psychological, financial, and social trials. Those of us with autoimmune hemolytic anemia simply have this set of ordeals. Like many other diseases, it's often invisible. Unless our hemoglobin drops to a dangerous level, you won't likely be able to discern that we're suffering. I can hide the circles under my eyes with concealer and brush pink powder over my cheeks. Yet presentation like this allow others to see a bit more. Patients, rare or not, are usually not asking for pity or sympathy. I'm not. I would like to be seen as a whole person. What would be helpful, though, is an awareness of the impact of autoimmune hemolytic anemia on our lives, informed medical care, and support. I'm just now 6 weeks out from my first bout with COVID. It was rough, although I didn't have to be hospitalized as many with autoimmune hemolytic anemia are. My hemoglobin was relatively good at the start, so I was in better situation going into the infection. A few days after I finished Paxlovid, though, I developed severe dizziness and a dramatic purple mottled skin pattern all over my body. I was told by a nurse to go to the ER. Then again, 2 days later, I was back in the ER with a high fever and heart rate over 120 at rest. Blood work showed a significant 2.5-point hemoglobin drop, as many autoimmune hemolytic patients experience with COVID or other infections. I was sent home to be followed as an outpatient by hematology. It's been 6 weeks, but my hemoglobin is still not back to where I was before I got sick. Many patients posting on social media report that they need drug therapy to maintain adequate hemoglobin levels after COVID. For those 5 weeks of acute COVID, I didn't do a great job of balancing my life. I spent far too much time Googling medical research articles. My psychological defense mechanism is intellectualization. I know that about myself. It gives me a sense of control to try to understand this very rare thing happening in my body that most doctors admit they know very little about. But when I'm feeling weak and can't stand for more than a few minutes and a shower wipes me out, I can take that Googling too far. No amount of reading will increase my hemoglobin. There is no perfect method to control our bodies. The writer Heather Lanier, author of Raising a Rare Girl, wrote an essay that went viral. Her daughter was born with a rare congenital condition, and Heather Lanier writes that she took supplements and did and avoided all the recommended things while pregnant. Yet she writes, I believed I could control the body because I could not stomach the truth that the body is fragile, ephemeral. Later, she writes, here's the thing. If you buy into a false narrative that the body is controllable, that illness can always be prevented, then by proxy, you are left with a disturbing, damaging, erroneous conclusion, the belief that a person's disability is their fault. I've often thought, and I sometimes get a sense from others, that if I just take the right supplements, see the right practitioner, think the right thoughts, I could overcome this. Yet this is not helpful. I remind myself that I'm doing the best I can. We are all uncomfortable with suffering and wish it would go away, but sometimes it just is. So once again, I return to my question, is it possible to share the details of living with autoimmune hemolytic anemia and not overly identify with being ill? Honestly, I don't know. Certainly, it's very hard when you are actively dealing with a flare or hospitalized. Illnesses, particularly acute situations, have a way of co-opting every facet of life. But it's certainly good to try. I'm a huge fan of using the mind-body connection. I meditate. I do isometrics and yoga when I can't exercise normally. I eat nutritious foods, lots of fruits and vegetables and nuts. I take probiotics, omega fish oils, and turmeric to reduce inflammation. I use chiropractic care, massage therapy, acupuncture. There's a great deal of evidence that my writing, gardening, piano playing, and sporadic painting, all forms of creative expression, boost dopamine and improve the immune system. While medical researchers don't know a great deal about autoimmune hemolytic anemia, a recent large multi-decade study in the European Journal of Hematology found that survival remains poor for patients with autoimmune hemolytic anemia. Thankfully, I've beaten by many years the reported median survival, about 4 years, for secondary AIHA. I've had this for 11 years now. Of course, it's difficult to extrapolate risk for individuals with such a varied and rare disease. There are just not that many of us in the world. But the study does state their results emphasize an unmet need in management of patients with autoimmune hemolytic anemia and cold agglutinin disease. So meditation, exercise, complementary care, creative expression, good food, and supplements might have helped me remain in the mild to moderate range of anemia. For certain, these practices helped me stay as strong as possible. And so this balance of sharing our realities while not focusing entirely on illness is as good a goal as any. We can let people know that autoimmune hemolytic anemia is a varied group of disorders that are linked to infections, autoimmunity, and cancer. It can range from mild to severe. Sudden or protracted hemolysis often requires transfusions, and remissions are possible. Untreated, it can lead to heart failure and death. We can explain how our body creates unique problems with energy, how infections are quite risky for us, and how lower hemoglobin is linked to organ damage, while we still center on our other identities. We can work on finding that balance between accepting and honoring our limitations while actively enjoying life. And we can increase our ability to reach beyond our own individual experiences, to be a part of the support groups on social media, which help us build solidarity and connections to others trying to stay afloat in the same leaky boat. I do believe it helps to remember that we are all far more than our medical conditions. It is our hope, those of us with this rare disease, that in the future, if you hear or see the phrase autoimmune hemolytic anemia, you might say, oh, I know what that is, and understand us a little better when we are too tired or inevitably cancel a social engagement. And if you're a medical professional, a doctor, a nurse, or particularly a phlebotomist, so many of us with cold agglutinins have a fervent wish that you will know our blood needs to be drawn into warm tubes, kept warm, and delivered immediately to the lab to be analyzed right away. I look forward to the day when more people, more doctors and nurses, have a basic understanding and familiarity with autoimmune hemolytic anemia. I'm grateful for this opportunity, and thanks for listening.